Welcome to The Explainer. Today, we're diving right into the incredibly high-stakes world of dental anesthesia. Choosing the exact right anesthetic isn't just some routine, thoughtless step before you pick up a handpiece. As we're going to explore today, it is the absolute foundation of patient safety.
Here is our roadmap for today. We'll kick things off with the Master Toolkit, move right into our everyday clinical workhorses, and then tackle those specialized problem solvers. After that, we'll build a comparative dashboard together, and finally, wrap it up with patient-first decision-making.
All right, part one, the Master Toolkit.
There are 5 distinct clinical archetypes we really need to unpack here, and this idea that this is the foundation of patient safety is our golden rule. Because listen, we aren't just numbing tissue to get a procedure over with. We are actively managing systemic physiological responses. Every single time you reach for that syringe, you're injecting chemicals that interact with the patient's entire body. Mastering this toolkit means deeply understanding that each of our 5 agents has an incredible primary superpower, but also a critical Achilles heel. Know your toolkit inside and out, and you know exactly how to protect your patient.
Let's move into part 2, everyday clinical workhorses.
We've got 2 standard agents that handle the vast majority of daily clinical practice, and we're starting with lidocaine 2%. It's universally known as the standard for a reason. This is absolutely your go-to for routine procedures. You know it, you trust it, it's highly effective, and man is it predictable. It's essentially the baseline of dental anesthesia.
However, these everyday tools still have strict operational limits. Because standard lidocaine contains adrenaline or epinephrine, you have got to avoid it in cardiac patients with sensitive arrhythmias. Furthermore, and while this is exceptionally rare, if a patient has a confirmed allergy to this amide class, lidocaine is completely off the table. The routine nature of this drug should literally never lull anyone into clinical complacency.
Now, let's contrast that with our next workhorse, mepivacaine 3%. We call this the cardio-safe option. Notice how this agent beautifully solves the exact problem lidocaine creates. Because it's formulated without adrenaline, it is a brilliantly safe option for those cardiac and hypertensive patients. It's also totally ideal for shorter procedures. Think your standard scalings, cleanings, and superficial fillings.
But let me be entirely clear about its strict limitations. You absolutely must avoid mepivacaine in prolonged procedures where you need an extended working time. And critically, and I mean this as non-negotiable, you have to avoid it in patients with hepatic or liver disease. Their bodies simply cannot properly metabolize it.
Okay, part 3, specialized problem solvers.
Look, when your everyday workhorses just aren't cutting it, we have to call in the heavy hitters. These highly specialized pharmacological profiles are strictly reserved for complex scenarios. First up is bupivacaine 0.5%. We call it the marathon, for a very good reason. This is your primary choice for extended maxillofacial surgeries, giving you exceptional, genuinely prolonged postoperative pain relief. When you are settling in for a long, complex case, this is the exact vial you reach for.
But keep in mind, this extreme duration carries the absolute highest physiological burden. You must categorically avoid this agent in patients with significant cardiac problems. And similarly, it is strictly contraindicated if they have severe hepatic disease. Because of its extreme potency, bupivacaine is never, ever used lightly.
Next up is articaine 4%, affectionately known as the penetrator. When a highly distressed patient is sitting in your chair with an acutely inflamed, hot tooth or irreversible pulpitis, articaine is your best friend. It boasts this incredible, truly exceptional bone penetration capability, which makes it perfect for cutting through the notoriously dense bone of the mandible.
But notice the red flags here. Its unique chemical structure brings very unique risks. You must avoid articaine in patients with severe asthma. Do not use this in pediatric patients under 4 years of age or in patients with underlying nerve or neurological problems. Honestly, its high 4% concentration requires immense clinical respect.
Our final specialized agent occupies a very specific yet incredibly important niche in your clinical arsenal. You'll recognize it by a distinct black band on the vial. This is prilocaine 4%, what we call the alternative. It's great for minimal interventions and light, short procedures. But way more importantly, it is an absolute lifesaver for pregnant patients who present with a known lidocaine allergy. In that highly specific scenario, it is the indicated alternative path.
But again, let's pause and focus on the absolute red flags. You must never administer prilocaine to patients with severe anemia or blood disorders, simply due to the risk of methemoglobinemia. Furthermore, it is completely contraindicated for anyone with severe respiratory or breathing problems.
Moving on to Part 4, the comparative dashboard.
Let's take a breath and just let all that sink in. We've just covered a massive amount of pharmacological data. 5 distinct clinical profiles, 5 unique superpowers, and quite literally a minefield of systemic red flags. To make this actually usable when the tension in the clinic is real, let's lock this in systematically using a mental matrix. Look at how they all align. Lidocaine gives you medium duration as the universal standard, but watch out for those cardiac arrhythmias. Mipivacaine gives you a short, adrenaline-free window, but it absolutely requires a healthy liver. Bupivacaine, that's your extreme duration heavy hitter, but you have got to avoid it in severe liver and heart conditions. Articaine gives you medium duration with unmatched bone penetration, but keep it far, far away from severe asthmatics and young toddlers. And finally, Prilocaine is your short to medium alternative for lidocaine allergies, provided the patient has absolutely zero anemia or respiratory issues. Boom! Now you have the whole picture beautifully organized right in your mind.
Let's bring it home with Part 5, patient-first decision-making.
This is where we completely flip the script. In practice, we don't just grab a drug. We observe the patient first, we determine the required path based on their unique biology, and only then do we select the drug. Let's walk through a real-world scenario step by step. Imagine this. A highly distressed patient sits down in your chair. They've got a hot tooth with acute inflammation, and you know for a fact you're going to have to administer a really tough mandibular block. You need deep bone penetration to overcome that acute inflammation. So what are you grabbing? Exactly right. Your choice is Articaine. See how that works? The patient's biology entirely dictates the pathway. If you have a patient whose medical history shows significant hypertension, clinical logic dictates an adrenaline-free path, so your choice is Mipivacaine. Prepping a prolonged maxillofacial surgery? You need extreme duration, so you grab the Bupivacaine. By deliberately mapping the clinical presentation to the drug, you entirely remove the guesswork and drastically enhance patient safety.
As we wrap up this explainer, I need to leave you with this final critical safety check. Knowing which drug to use is important, sure, but knowing when not to use an agent is what truly matters. Liver disease, you must avoid Mipivacaine and Bupivacaine. Severe asthma, you absolutely avoid Articaine. Anemia, no Prilocaine. These are the absolute non-negotiable contraindications that protect lives. Well, we've unpacked the entire master guide today. You now possess the master toolkit, you deeply understand the comparative matrix, and you have that patient-first decision tree mapped right in your mind. The science is entirely in your hands now, but the ultimate question remains. You know the tools, but will you catch the red flags before the needle drops? Keep that vigilant sharp, and I'll catch you in the next explainer.